Welcome to Something to Talk About. This is the Bainbridge Island Senior Community Center, and we're happy to have you here. Marilyn Gremse is here, and she's going to talk to us about SHIBA, State Health Insurance Benefit Advisors. We'll get to that in just a minute. I want to acknowledge that we are meeting on the homeland of the Suquamish people who have lived on these waters of the Salish Sea since time immemorial. We are grateful for their stewardship, and we hope to continue to learn from them. We could be much better stewards of these lands and waters, and with their help, we can be. Also, I'd like to thank Fieldstone Communities of Bainbridge Island, which offers independent living, assisted living, and vibrant memory care. They sponsor Something to Talk About, and you can find out more about the goings-on at their beautiful Rolling Bay campus and ask about day stay and respite programs. They'll even treat you to lunch or dinner if you call and let them know you're coming, and they'll give you a tour. Call Celia or Jamie at 206-594-1010, fieldstonecommunities.com. Marilyn, I see you fairly regularly because you come down to the senior center and help out with folks who are trying to figure out how to navigate Medicare. I appreciate that. So let's start off with you just telling us a little bit about what that program is that you volunteer to help with. SHIBA.
Okay. Thanks everyone who's dialed in. How many participants do we have, Reed?
We have 3 right now. Other
Okay.
folks might join us, and we're recording this, so we'll put it up on YouTube for folks to watch or listen to later.
Okay, excellent. So again, my name is Marilyn, and I am a volunteer with an organization called SHIBA. SHIBA is a arm of the Office of the Insurance Commissioner, and we provide public education on all things Medicare. In addition to general education and presentations, which we do regularly, we offer one-on-one counseling to talk about your specific situation and see if we can be of assistance. So myself, I've been doing this work about 8 years, and I have a background as a case manager, social worker at Helpline House. So I have to say that I love doing this Medicare work, and I know it's very complex for a lot of people, and I really enjoy being able to guide people through learning about it and making changes if that's what they want to do.
I know that the rules change a little bit almost every year. And
Yes,
so you have to go through some regular updates yourself, don't you, as a volunteer?
absolutely. We have quite a long initial training process and a certification exam that we do. And then we have monthly meetings, which update us on specific topics year round. So, yes.
And so you're providing information similar to what maybe an insurance broker might, but you're doing it from a position without sort of it being a business. You're learning from the outside. You're not going to make a direct recommendation.
Right.
You're just going to tell me what my options are.
Exactly. So the way that we differ from an insurance broker, and nothing against insurance brokers, they're very helpful to a lot of people, but they are commercial, and we are not. So we're a public organization, and so we provide unbiased help. And what I mean by that actually is that we will tell you all of the options that you have. Insurance brokers, just because of the way they work, only carry certain lines of insurance. So while they can tell you about the government program of Medicare, they may not actually share with you all of the options you have for your additional coverage, which is through private insurance companies. So in terms of complete education, we're able to offer a bit more than a broker. So.
And of course, if you're looking for somebody to tell you what your options are, a broker is more likely to do that. And I'm sure there are absolutely responsible brokers who might tell you if you ask about lines or options that they don't carry or couldn't help you with. But from your perspective, Marilyn, it's one option is just as good as another from your perspective. It's what matters to the person who's sitting across the table from you.
Right. I think where we really excel is in not only the presentations, which I think are like really excellent, introductions to Medicare. We do those regularly, but also in coaching people through the process. So someone might come to us who is completely new to Medicare, and we will tell them about Medicare, but we'll also explore how they receive medical services, who their providers might be, so that we can help them identify for themselves what's most important to them. And then we can match up what's important to them with the options that are available. So that's a really crucial part of what we do, because not all people like to get the same medical services in the same way. So
And issues like where you travel or when you travel,
yes.
or what kinds of things you would like to have included in your insurance coverage, all those things make a big difference on which kind of a program you might deal with or choose. And it's an alphabet soup, which is what you were talking about a little bit with the upcoming presentations of folks who might be new to Medicare to understand what parts A, B, D,
Right.
C, and more are. So you have a
Right.
couple of those coming up already at the library. Can you give us a heads up on those
Yes.
dates?
We have one actually very soon. So March 19th, we're doing a presentation at the Bainbridge Island Library at 5:30. So that will be labeled or titled New to Medicare, but it is for anyone who wants even just a review of Medicare or to understand better how Medicare works. So we do have people that are approaching 65 and need a solid, introduction. And then we have people who aren't quite sure how Medicare really works, even if they already have the program. So we will be doing that one in March.
Oh, I'm sorry. I don't mean to interrupt. And then you have another one coming up later in the.
Yes, in July. And that's on, I think, the 22nd.
Before we started
Yeah,
here, that is what I have down here is the
yeah,
22nd of
thank
July
you.
at Kitsap Regional Library on
Yes,
Bainbridge.
on
And we're
Bainbridge.
talking about trying to schedule one in between those two here at the center. So keep your eye out about that as well. So one of the things that is confusing, I would say at a high level for those of us even who have been on Medicare, is that there are kind of two major flavors. There's
Mhm.
Medicare and then there's Medicare Advantage.
Yeah.
And today we're going to talk about options that are open to Medicare Advantage. But before we do, do you have a brief way to describe the differences between those two?
Sure, sure. So Medicare in general is a government provided healthcare plan for seniors. I mean, that's at the basic level, that's what it is. So we've paid taxes into this program, and it's available then at age 65. The government does manage a health plan. It's a public option health plan, so that your bills for healthcare would go directly to the government and be processed by the government. The other type of Medicare is still Medicare, but it is called a Medicare Advantage plan. And those are private insurance companies or healthcare systems that have contracted with the government Medicare system to provide Medicare services. So in both instances, no matter which type of Medicare that you have, all services that Medicare covers will be covered under both types of Medicare. General Medicare is what they call, you've probably seen this on your printouts for your insurance coverage, called medically necessary. So it is treating illness, conditions, disorders, and so forth. The Medicare Advantage plans absolutely do that, but they also offer a number of wellness type services. So their focus is more on keeping you well, if you will, by providing such things as health club memberships, alternative health care, dietary coaching. I mean, a wide variety of services depending on the plan that you select. So, all of that said, even if you're in the public option, you will have some connection with some private insurance companies in order to provide yourself with the most complete coverage possible, including drug coverage. So, yeah.
So there's a regular sort of time in the year, unless you're just turning 65, a regular time in the year when you can change if you're in a well, I guess it's if you're in either kind of program.
Yeah.
If you're in a standard or original classic Medicare, you can
Yeah.
make changes on supplementary insurance during a period of time that's around the turn of the year, right?
Right. So this is known as open enrollment, and you'll see ads even on TV. Open enrollment, and it is from October 15th to December 7th every fall. And what that means is that all people already enrolled in Medicare can look at their coverage and decide if they would like to perhaps have a different option. So a person that's in an Advantage plan could look at the possibility of going to original Medicare to the public plan and vice versa. The other important thing about the open enrollment period is prescription drug coverage. Every year, prescription drug plans are revised and changed, and you may get a notice at the end of the year that something that has been covered on your drug plan no longer is covered. That doesn't mean that it wouldn't be covered on a different plan. So I always recommend that people think of that period of time not only as like the big switch, but also like a prescription drug checkup. So it's like check in, see if there's a better plan for you. If your prescription drugs have changed over the year, it may be that you could actually save money by changing to a different plan. So that's a big part of open enrollment.
Well, so that period is over for this year
Yep.
for 2024. But you reached out to me to say that if you are in an Advantage plan and you want to stay in an Advantage plan, which is what you were just talking about, the sort of
Right.
more wraparound services, you
Mhm.
have some options through March 31st. Could you
That's correct.
describe what that's about?
Yeah. So every year, in addition to that open enrollment period, like Reed just said, people that are already in an Advantage plan, January through the end of March, have the option of changing which Advantage plan they're enrolled in. So that period is open right now, and that's one reason that we're talking today, to be sure that people know about this particular option. There are a number of plans in Kitsap County available. And if for some reason you are unhappy with your Advantage plan, or you were in an Advantage plan last year that you really liked, you can take a look to see if that insurance carrier has another plan for you. In our county, one reason I'm talking about that is United Healthcare was unavailable to folks during open enrollment. Their Advantage plan was not available during open enrollment. And we had a large number of people enrolled in United Healthcare. It's one of the largest insurers in Washington. And they also covered St. Michael's and Virginia Virginia Mason. So it was a popular plan. That was no longer available. However, as of December 31st, United Healthcare signed a contract with Virginia Mason and Franciscan so that United Healthcare does have an MA plan. So if someone had a MA plan with United Healthcare, they were happy with it, and they want to return to United Healthcare, this would be the period of time that they would have an opportunity to do that. And not just United Healthcare. You could go to a different Advantage plan at this time too.
You mentioned that it not only involves preferred provider plans like the United Healthcare, but health maintenance organizations like Kaiser.
That's
Covered
correct.
that way.
That's correct. So there's kind of two different flavors, if you will, of Advantage plans. Preferred provider organizations are, they use a network of providers, and an enrollee in those plans has access to those lists and can select among whoever accepts that MA plan. The HMOs are a little different. Kaiser is the best known in our area. They are often healthcare organizations as opposed to straight insurance companies. And their model is that you have a primary care physician who coordinates all of your care. So you would get referrals directly from your primary care doctor. Both of these types of plans have what I call the additional benefits, like I talked about. Some of the things they can offer are the alternative health care, the gym membership. Many of the MA plans have available for additional premium, typically, such things as dental care, vision care, and that sort of thing. So that's one thing that attracts a lot of people if they have dental work to do.
What are the considerations that I need to make if I'm going to try to make this, like, if this is the month to do it?
Yes, it is.
And I need to be on an Advantage plan to be eligible for this enrollment period.
That's correct. You have to already be in an enrollment period. If you are in original Medicare and want an Advantage plan, you'll have to wait until the open enrollment in the fall, and the effective date would be January.
And in this case, the effective date is the next beginning of the whatever month. So if you're going to do it in March, it's going to be April.
It's going to be April 1. Yeah. So you won't have a gap in coverage or anything. So that would be April 1. Yeah.
Okay. Anybody on the call have a question they want to ask directly to Marilyn at this point? Rita.
I don't really want to ask a question, but I want to just say Marilyn has helped me the past several years, and I've changed some plans, and it is really good. So I would encourage people to get a hold of her or go to the seminars that are available for her.
Thank you, Rita.
You're welcome. Thank you.
Those seminars are overviews. There'll be a number of people there, and it's really a great way to, if you're thinking about having an appointment with Marilyn or Ann, both of whom have regular appointments here at the Senior Community Center. Going to one of those presentations, if you can, is a great first step, because then you have a lay of the land.
Right.
And take advantage of those individual appointments, and Marilyn will answer all your questions and
that's a high bar, Rita.
and move you in the right direction.
Right.
It's really good.
Susan, did you want to get in here?
I wanted to get in here. You know, I'm a temporary visitor to Bainbridge Island, so I'm in a little different situation.
Okay.
And I think if any of us travel to go stay with our grandchildren or family in other parts of the country, it's really important to ask your provider, especially if you have an Advantage plan.
Yes.
What if I get sick over in, San Diego or in Bainbridge Island? What do I do? And what Humana told me is I cannot go to any doctor, say my children's doctor. Can't go to I can either go to the urgent care, which is very good on Bainbridge, or the go into the Seattle to an emergency room.
Mhm.
And I hate, you know, the expense goes up when you go to an emergency room. And if it's just something little, you really want to do urgent care. Have any of you had that kind of experience traveling?
It's one of the things to think about when you're looking at, when I was saying that earlier about original Medicare might have a larger window of people
Yeah.
that you could get coverage from, right, Marilyn?
Mhm.
Right. The way to think about it is that Medicare itself is a network plan. So anybody you see nationwide, because you can go to anybody nationwide, but only those that are contracted with Medicare. But that's a pretty large network. The Advantage plans have a narrower network, and that is why they have typically are a little less expensive. That's one of the features and one of the things that attracts people often is the cost. But they have a much narrower list of people you can go to.
And you can be in an out of network situation, like
Yes.
Susan's talking about. They may not have doctors in where
Yeah.
you're going
That's
unless
correct.
they're a big network.
Again, it's a coordination, like Susan did. She called her Advantage plan to talk with them about what would she do if she got ill. All Medicare plans are going to cover emergencies. And Susan, that's, I believe, why
Yeah.
you were referred for urgent care or to an emergency room. Any other care you would have to coordinate through your MA plan.
Right. Thank you.
Yeah, you bet.
One of the things that Rita was saying was that she was recommending that people set up a one-on-one appointment with you or your colleague Anne. And how do you go about doing that?
Okay, that's actually pretty simple. We work in partnership with Helpline House. They do our scheduling, so they have our schedule. Anne and I both offer weekly appointments, and generally there's only a week or two wait, so it's pretty straightforward.
So you would call Helpline House and ask to make an appointment that would be here at the Senior Community Center. So
correct.
you call Helpline, you show up at Bisque. So
Yes.
the phone number is 206-842-7621. And they'll know exactly what you're asking about and
Yeah.
be able
Yeah.
to help you out.
Yeah, they're very good.
And you have a lot, like an hour, is that
Yeah,
generally what you do?
we have about an hour. If you're brand new to Medicare, which Susan and Rita aren't, but people that are brand new to Medicare sometimes come for a couple appointments. If they really need the full education, that's usually a little less overwhelming than trying to squeeze everything into one appointment. But yes, we have an hour together and it's private. So we have an office. So in terms of confidentiality and so forth, we're bound by all of the privacy what do you want to call it? Parameters, so none of your information is shared outside of our organization. So
if you are a Medicare user, if you are enrolled, you've got a Medicare and you book in the mail probably.
yeah,
And the thick thing that looks intimidating.
I don't know if you can see that.
I start to look through it and my eyes start to cross. But there's some good information in there. You said in the notes to me that you can find out what kind of Medicare Advantage programs there are in our
Yes.
county by looking through that book.
That's correct. So they list all the ones in the state. So then you look through and find the ones that are in Kitsap County. It will give you general information, but if you're considering switching, sort of compiling a list of those companies that sound good to you, and then calling them on the telephone is the best way to determine if it's going to be a good fit for you.
And I remember doing some research online. Is that also possible? I know I did in the past.
It is, but it's very rudimentary when it comes to the MA plans. Now, one thing that it does well online, however, is if you put your prescription drugs in, it will tell you which MA plans have the best coverage for the medications that you're on. So it does a good job of that, but it won't necessarily give you all of the detail about like premiums for the dental plans that they might offer or the coverage that you might have under the vision component of their plan. So those details at that detail level, you would need to talk to the plan. But remember, anything that's covered by Medicare is going to be covered by an MA plan. There is no question about that. It's just the extra things that they might say. We used to have at least one plan that had some out-of-network benefits at lower coverage rate, like at 50%. I don't believe we have any right now. But that's something to look for if you are on an MA plan and do travel. So I'm talking to you, Susan. There could be a plan possibly that would offer you out of network. Are you in Washington, Susan? Can I ask?
No, she's in Nevada, right?
No, I'm in Las Vegas where it's about 70.
Okay.
We're starting to get warm here. It's in
That's
the
what I've
60s.
heard. Yeah.
But
Sheila, I think, had a question too.
okay, Sheila, yeah.
It's sort of just a sort of a general one. Marilyn, thank you first of all for being here.
Of course.
I think I know what I have. I have a Medicare Advantage with Kaiser. I had one that all of a sudden started charging me for premium. I'm low income, so usually I hadn't had to pay any premiums before. Then all of a sudden I had this charge of $40 or whatever. And so I called up my Kaiser people and asked them about this. And I talked to this nice young man. And he said, "Do you go to the gym?" I said, "No, I don't go to the gym." He said, "Well, you don't really need to have the big one then, because the $40 of that one probably has a lot to do with going to the gym." So he switched me over to a different plan under a key plan. And I guess my question, Marilyn, is this: would it be good for me to come? I'm sort of thinking of it like I go to a wellness exam with my doctor once a year kind of thing, and come and talk with you and just say, "This is what I've got." And I'm really pleased with my Kaiser. I don't want to get rid of that. And I love my Medicare Advantage. I'm very pleased with that.
Right.
I've had it for years. And would it be good for me to come and just lay out, this is what I've got. What do you think?
Well, I have a couple points in response.
Okay.
One is that if you are low income and you weren't paying a premium because of that, it may be that your status didn't get renewed. And so you can reapply and you can then get your premium paid. So that is certainly something to look into, and that is something that we can help you with. It's called Medicare Savings Program. The income guideline at the upper level is fairly low. It's about $1,500 a month. But there are some ways that they process those. So if you're anywhere close, it's always worth applying for that benefit. So we could certainly help you look at that. If you are eligible, then you have additional opportunities outside of this March window. So if you are eligible, you could even change, back to the other plan if you wanted to, if you qualify for the Medicare Savings Program.
Okay.
So, yeah.
Probably what you're saying is maybe I ought to make an appointment with you, right?
I think it might be to your benefit if you are paying any premium at all right now. We could look at that.
Yeah, they added $3.25 on. Wherever that comes from. I have absolutely no idea what that's all about, but
I don't know. But just based on the fact you said you weren't paying anything and now you are, I'm a little bit suspicious that your status changed and you would want to get that remedied. So
Oh,
They did
Sheila,
mention that well, I just wanted to answer because
Mhm.
people asking about this. The suggestion from the Kaiser people were to call my Social Security, call Social Security.
No, Social Security has nothing to do with the low income
Thank
program.
you.
Nope.
Thank you. I don't
It
want to
is-
spend 5 hours on the phone
No.
waiting for somebody to talk to me on
No,
Social
not
Security.
at all. So
Okay, I'll
they aren't
call it.
very, yeah, Kaiser knows Kaiser, but they don't necessarily know the programs. It is offered by the state. So it is the state of Washington Department of Health and Human Services. that
So
has
what do I need to bring with me when I talk to you?
your Medicare card, and if you have your Social Security statement that shows your income, that will facilitate things.
Okay, thank
Okay.
you very much.
Oh,
I
and
will
the
see
num-
you.
yeah, call 206-842-7621.
Yep.
That's helpline, and make an appointment, Sheila, and we'll see you here down at the center for the meeting with either
Oh,
Marilyn or
I know
Andy.
where that center is. I've been
You
there.
sure do. And then, Marilyn, there is a statewide number if people just want to get help over the phone, right?
There is. So, actually, the number I'd like to offer is our local SHIBA number, and that's a Kitsap County, wide service, and that's 360-475-3095. And, we see people on Bainbridge at the senior center, but we also have volunteers that are at Peninsula Healthcare Services. We have volunteers that do phone appointments or video calls. So by reaching out to that number, they can give you some alternatives. If we are completely booked up and you really need to be seen before the end of March, definitely call them. But they're
Okay,
helpful year round too. If you just need clarification of anything, they can take a quick telephone call for you.
it's 360-475-3095.
Correct.
Okay, and again, the dates at the library coming up March 19th, Kitsap Regional Library at 5:30 p.m. for an overview of Medicare for those who are new or just would like a little refresher.
Right.
March 19th, and then later July 22nd, same time, 5:30 p.m.
Right.
Thank you, Marilyn, for taking the time today.
You bet. I'd be happy to see anybody that needs our services, and I wish you all the best. Are there any other questions before we finish? Okay.
Doesn't look like it. Thank you very
Okay.
much. And I, again, appreciate you taking the time and every week coming and helping people. What
You
a
bet.
what a wonderful thing you're doing as a retiree, helping others of us figure out how to manage our own retired or near to retirement time. So have a good weekend.